Hello, my name's Ollie Morris and I'm a GP in Southampton.
And my name is Sally Hinder and I'm a health visitor in Farnborough.
And in this video, we're talking about sore throat in children. So I'm sure you know what a sore throat looks in a child. They will have told you that they've got a sore throat. They're not eating so well because it's painful when they swallow, whether that's food or liquids. And they've often got other features as well with that sore throat. So they might have a bit of a temperature. Many sore throats are caused by viruses, so they'll have other viral upper respiratory tract symptoms like a runny nose or a cough. And they might have some swollen glands around their neck. And if you're able to get them to open their mouth and look at the back of their throat, it looks quite red and angry, and possibly the tonsils are a bit swollen and maybe even have some pus on them. So there's your child with a sore throat, and what you're wondering what you can do to help them keep comfortable, and whether they need any extra treatment that you can't offer themselves, and whether it's actually something a bit more serious than a sore throat. So in this video, we're going to talk about those things, starting with Sally, who will tell you what's typical of a sore throat and how you can help your child with it.
So sore throats often take anywhere between about 4 to 7 days to recover from, and obviously for a child that's in distress or pain with a sore throat, that can feel like it's quite a while. The main things that you're going to want to do to treat a sore throat or to manage the symptoms of the sore throat is make sure that you are managing the pain and keeping your child comfortable, and making sure that they are managing to take on enough fluids. So things that you can do to encourage both, so things like an ice lolly that gives children fluids, and it also can help with easing the pain of a sore throat because it'll be really cold, and that can often kind of numb the throat area. You can also do things like offering cold yogurts, cold drinks, whatever it is that they would normally drink. Then you can make them nice and cold, put them in the fridge, or do something like that will help. Also offering softer foods as well, so things like mashed potato, banana, things that aren't particularly sharp or rough, so that when they swallow it's not quite as uncomfortable. Obviously, if you are still breastfeeding your child, or your child is still taking formula, then you'll still be wanting to offer that as much as you would have before. It may well be that they are wanting more little and often, and that's absolutely fine as long as they are keeping those fluids on. That's good news. You can also use things like paracetamol and ibuprofen to try and keep on top of that sore throat as well, and hopefully that should help them to ease a bit of that pain and discomfort. And if you're easing that pain and discomfort, that should help them swallow and help them keep those fluids on board as well. As Ollie mentioned, sore throats are generally caused by viruses, so generally antibiotics aren't going to be much help. If antibiotics are used with viruses, they don't really make much of a difference to the duration or the severity of an illness, and they do come with their own side effects, things like diarrhea and antibiotic resistance as well. However, there may be some times where a child does need antibiotics, and Ollie will just talk about those now and some of the other red flags to look out for when you need to go and see a health professional.
All right, so when do we use antibiotics for sore throats? Now, if I'm honest, there's not really a good hard and fast rule when you've got a child in front of you of knowing whether they've got a viral illness where antibiotics isn't going to make any difference, or a bacterial illness where they might. But there are some indications, and there are sort of strategies we use to assess children. So it's the context is important. So if you've got a child that's got other symptoms that are quite typical of an upper respiratory tract infection caused by a virus, so they have got a runny nose, they have got a cough, maybe there's someone else in the household with the same sort of illness or a viral illness, that means that antibiotics are less likely to be helpful. Conversely, if you've got a child that's really just got a very sore throat and not much else going on, a fever and a sore throat, and they've got really quite obviously swollen glands at the side, and if you can open their mouth and see the tonsils at the back, they're really red and angry and got pus on them, that makes it much more likely that it's bacterial, and antibiotics may well help. And particularly if the fever is carrying on for a few days, that might be another reason for treating with antibiotics to get the child better quicker. But most children, if they are managing fluids, reasonably comfortable with paracetamol and ibuprofen, and they've not got any other concerning features, you can just keep looking after them at home and you'll be doing fine by them. Another case where we might want to use antibiotics, obviously, is if we think it's a particular type of sore throat. And here I'm thinking of scarlet fever. So obviously the key thing about scarlet fever is it won't just be a sore throat, but you should have other features. So in particular, the rash, which can come on after a couple of days, usually starts in the torso and spreads up the neck to the face and the arms. And it's a red speckly rash. It can get a bit rough with time. They should have quite obvious glands at the sides of their neck as well, because they're very sore throat, have a significant fever above 38. And they would also probably have this red tongue, or can have this strawberry red tongue. So if you look at the tongue, it's obviously quite red and inflamed. Those are all features of scarlet fever. And if you've got a few features of that, again, it's well worth talking to a doctor or nurse, and you can make a decision together whether you think it's scarlet fever and antibiotics are going to be helpful. Finally, it might be that you're just concerned that, whatever it is, it may just be a sore throat, but your child's actually more unwell with that and struggling. And there the features are similar to a lot of the pathways in the Healthy Together. So actually, if you just look at the fever pathway, the red and amber features there, it will describe a lot of the things, but they are quite obvious things. So the red features are ones where you need urgent attention. You can best get that by taking them straight to the emergency department, calling 999. And they're quite obvious things like if your child had a seizure or a fit with this high fever and a sore throat, or if it's not just a sore throat, but they're really struggling with their breathing, you don't think they're getting enough oxygen in their body, they've got blue lips, breathing very, very fast, or it's suggestion that their consciousness isn't normal, they're difficult to wake up, confused, very, very excessively drowsy, you can't wake them up, you can't keep them awake. Or they might have that rash that we all know about, where you try and press on it with a tumbler, a glass tumbler, and it doesn't fade or go away. So those are the red features of serious illness in children with a fever. Then you've got the sort of amber features, and they might be ones that either you need to see a doctor or a nurse because antibiotics might be helpful, so some of the things I talked about earlier, or because you're just concerned, in particular, not getting the fluids on board, so that they're getting a bit drier, and the drier their mouth gets, the more pain they're in, the more painful their throat is, the harder it is for them to swallow fluids. So it's really important to get onto that, out of that downward spiral early on by good pain relief and encouraging lots of little fluids in the way Sally mentioned, so that they don't end up with a throat so sore they can't swallow fluids. You can sometimes, obviously, with a sore throat, get some complications locally, and the one we look out for is quinsy, which is when you get an abscess in one of the tonsils, so that the infection really builds up in one tonsil. It should be just one side of the throat. You'll get quite an obvious swelling underneath the jaw. If you can look in the mouth, you might see that one tonsil is much, much bigger than the other, and even pushing the uvula, the little dangly bit, over to one side. But you might not actually be able to look in their mouth, because if they've got a really big abscess back there, they're not going to want to open their mouth very wide. And that could be another sign that something more significant going on. And it might be so sore that they won't even swallow their own spit. So they're kind of drooling or spitting out of their mouth. So any of those features, definitely speak to a doctor or nurse, because if they have got an abscess, the only real treatment for that would be to get that drained, and they'll need to have a trip to hospital for that. Again, not very common at all, but if you look out for those features and you get any of those, you'll know what to do. So that's really all we had to say about sore throats. I hope that's been helpful for you. If you look at the Healthy Together website, there is an entry on sore throats. It goes through the red, amber and green features and some of the issues that Sally talked about how long the sore throat will last and the pros and cons of antibiotics.